The latest information about that botulism outbreak after a potluck dinner at a Lancaster church. A 54-year-old woman who ate at the dinner has died. There are 18 other suspected cases. 21 people are being monitored. The Centers for Disease Control and Prevention flew in antitoxin last night, and it was given to those who are believed to have botulism.
Dr. Larry Swanner joins us now from Mount Carmel West. 5 patients are being treated amongst those hospitals. First off, doctor, botulism isn't contagious, so what is it?
Botulism is an infection caused by a bacteria. It generally, foodborne botulism, I should say, generally must be contracted by eating contaminated food.
So tell us about this particular kind of botulism. You get it through foodborne illness. Tell us more about how that's possible.
Well, the bacteria seems to prefer nutrient areas where there is low oxygen, which is why typically we talk about canned food being the culprit for setting someone up to contract this. The real damage that botulism causes is that it releases a neurotoxin after it's injected, and the damage occurs from the neurotoxin after someone ingests the bacteria, and of course it multiplies, and then the neurotoxin is released, and that causes severe damage to the nervous system of the patient.
And it might not show up, the symptoms that is, might not show up right away?
That's true. Typically there is described a fairly wide time frame of incubation. Although patients can start showing symptoms within a few hours after ingestion, that can actually extend up to several days before they'll start showing us symptoms.
And you talked about canned foods. Is there any other way that this could be transmitted from food? Any other kinds of foodborne issues?
Well, in any food that is ingested that's contaminated with the bacteria will potentially infect the individual. Just most commonly, that is going to be canned food, and that's what's typically described as causing the infection. But certainly there are other foods that could harbor that infection, but they are not nearly as common.
So it really speaks to proper food handling and care.
And preparation, proper canning in the first place. Yes.
Dr. Swanner from Mount Carmel, thank you for coming in.
My pleasure.
Thank you, sir.
Sure.